And we are back with Dr. John Kressel of Phoenix Cyberknife with one of his patients who has been here before, and we're so happy that he's here again. Joseph Liguori is joining us again. Joseph, it's so good to see you.
It's good to be back.
It is good to have you here, and I just want to set up the story just a little bit, Dr. Kressel, if you will. 14 years ago, Joseph was diagnosed with brain cancer.
Lung cancer.
Lung cancer, I apologize, lung cancer. Kind of set up the scenario, that all the things that he went through prior to coming to Cyberknife.
Well, Joe's been through quite a bit, yes. He was initially diagnosed with metastatic lung cancer and told he basically had 3 to 6 months to live, nothing really to do by big institution back out east. Joe didn't accept that, and became a patient advocate, started seeking out different treatments. Had 2 different forms of radiation therapy, and then had a recurrence and came to see us because we needed to treat him with any area that had been treated with radiation before, which is very difficult to do, but with Cyberknife and radiosurgery, that's the state of the art in retreatment, and was able to offer him that.
So I want to talk a little bit, Joseph, about before Cyberknife came along, because we're going back 14 years here.
Correct.
For you.
Correct.
You had to try other forms of treatment.
That's correct.
Tell me the 2 forms that you've tried.
At that time, there weren't the options like there are today. So I had what's called full brain radiation every single day for 30, 35 days. My head was literally red, and it was nauseous, and just a long, tedious process. And it's broadband, so you don't really know how well it's doing.
Right.
Now the second one was called Gamma Knife. That one, you had to be under anesthesia. They put a metal bracket on your head and screwed it in literally with a drill to keep your head steady. Very painful, very nauseating. It took me a while to recover from that. And as I continued to do my research and look for the best doctors and the best techniques, that's when I came across Cyberknife. When I had Cyberknife, it was like night and day. And that's why it's so good to get this word out, because people don't know that. And so you need to always look, what else is there for me? When I had that, no anesthesia, nothing, no side effects, no nothing. I just laid on the table. After about 20 minutes, got up and I went through my normal day. I mean, totally different than the other techniques.
I can't even imagine. Were you even wondering, based on what you've been through, were you even like, is this really working?
Yeah.
I mean, did somebody turn the machine on?
Yeah.
I'm sure you had to ask that question, right?
And a lot of people aren't aware of it. And what I try to tell lots of cancer patients is, you're unique. So don't just accept the standard radiation of wherever you happen to be having your oncologist and hospital institution. Always look out, continue to learn what is best for me. Cyberknife, without a doubt, and I've known a lot of different types of radiation techniques, is the most potent, the most effective. No anesthesia. People don't know that.
I have never met anybody quite as experienced in cancer treatments as you are. So thank you so much, Joseph, for coming in and sharing your story. I think we're just going to leave it at that, Dr. Kressel. I think you've said it all.
He's a great patient ambassador.
And think about it, 14 years ago, he was given just a couple months to live, and he's still here with us, spreading the good word, so we appreciate you. We appreciate you, Dr. Kressel. And if you have any questions at all for Phoenix Cyberknife, Radiation and Oncology Center, it's simple. You just email them to info@pcroc.com, and they will get back to you. Here's where they're located, 4611 East Shea Boulevard. That is in Phoenix. You can also call them at 602-441-3845 and learn more by visiting the website, phoenixcyberknifecenter.com.